Developmental disabilities, causes and classifications. Causes of developmental differences. Biological factors. Biological insult refers to interference with or damage to an individual's physical structure or functioning.
Genetic disorders resulting in abnormal biological development may be caused by deviations in chromosomal structure or by abnormal single genes. Syndromes are groupings of similar characteristics known as stigmata. Syndrome. This condition is caused by 3 number 21 chromosomes. It is recognizable by a flat face, upturned eyes, small ears, short stature, and the simian crease. Heart and intestinal abnormalities are common.
Fragile X syndrome, caused by a break on the X chromosome present in males. Sex-linked disorder given to sons by their mothers, characterized by large ears, language delays, autism-like behaviors, hyperactivity, and delayed motor development. Metabolic disorders. These cause a breakdown somewhere in the complex chemical activities needed to metabolize food. The breakdown can destroy, damage, or alter cells. Metabolic disorders are single gene defects such as PKU. Abnormal gene disorders, Tay-Sachs, an accumulation of fatty tissues around the brain that eventually leads to death. Cystic fibrosis, a buildup of mucus in the lungs which make it difficult to breathe. Breakthrough medical treatments are now helping these individuals live longer and more productive lives. Sickle cell anemia. The red blood cells are not formed correctly, making it difficult to navigate the bloodstream. It is often accompanied by joint pain and ulcers. Duchenne muscular dystrophy, present in males where the muscles deteriorate. Prenatal infections and intoxicants. Rubella leads to devastating lifelong and severe disabilities. CMV. Children appear normal at birth. Later in life, they develop intellectual disabilities, deafness, and diseases of the eye. Herpes simplex. Inflammation of the brain and spinal cord. AIDS can be passed to the unborn child through the birth canal or breast milk and leaves a child's immune system helpless to fight off disease. Maternal diabetes. High risk for developmental problems in a child. Preeclampsia. Complications that can lead to death in mother and infant. Prenatal infections and intoxicants. Alcohol and other drugs have been proven to lead to birth defects such as fetal alcohol syndrome and fetal alcohol effect. Poor nutrition, including lack of protein, can lead to low birth weight, illness, and higher risk of death in the first year of infant's life. Poor nutrition can also damage the developing brain and nervous system. Birth complications. Lack of oxygen to the brain, anoxia can occur. Premature babies can suffer hemorrhaging. C-sections may need to be performed if the life or the mother or infant is in danger. Complications following birth. Meningitis, a virus or bacterial infection that causes inflammation of the protective covering of the brain and the spinal column, can lead to brain damage. Encephalitis, swelling of the brain can lead to brain damage. Lead poisoning. Poisoning from lead found in lead-based paint in older homes can damage nervous system. Poverty, nutritional deficiency. Children living in poverty have inadequate nutrition. WIC was designed to eliminate some of the counter effects of poverty. WIC provides funds to pregnant mothers and their newborn to purchase healthy foods. Inadequate health care and education. Living in poverty, many women do not seek out prenatal care, leaving themselves open for premature labor and other complications. Regular medical checkups are also good for the newborn child. Without health insurance, good care is not always possible. Homelessness and substandard housing. Living in these conditions can cause health problems by being exposed to contaminants in the environment. Single-parent families. Single mothers in particular tend to work multiple jobs, leaving their children unattended or with little supervision.
Child care. Quality child care can combat the effects of poverty, but people living in poverty often cannot afford quality. Centers need to offer the best with what they have, making quality available to all.
Categories of disability under the IDEIA. Specific learning disabilities, a disorder in one or more of the basic psychological processes involved in using language, spoken or written. Speech and language disorders, difficulty with receptive or expressive language. Developmental delay, delay in one or more of the developmental domains. Intellectual disability, sub-average general intellectual functioning, along with deficits in adaptive behavior. Emotional disturbance, behavioral or emotional responses that are different from age, ethnic, or community norms. Multiple disabilities, a combination of one or more disabilities, hearing impairment and deafness. Hearing impairment is a hearing loss that adversely affects educational performance. Deafness is a hearing loss so severe that individuals cannot process spoken language even with hearing aids and or other forms of amplification. Orthopedic impairments, developmental problems that interfere with walking or other body movements. Other health impairments, limited strength, vitality, and alertness. Visual impairments, a range from partially sighted to blind. Individuals who are partially sighted read large print or possibly regular print. Individuals who are blind have a severe enough vision loss that they cannot read print. Combined deafness and blindness, a child has loss of both vision and hearing. Autism, developmental disability significantly affecting verbal and nonverbal communication and social interaction. Traumatic brain injury. This category of injuries to the head causes tearing of the nerve fibers, bruising of the brain against the skull, or bruising of the brainstem. Each category describes a condition that makes a student eligible for a free and appropriate public education. To meet the definition, a child's educational performance must be adversely affected by the disability. Category does not prescribe the services for a child, but a program should be planned based on individual needs.